The CDC just released data showing that 67.3% of Americans over 60 have some degree of age-related macular degeneration, but only 18% know they have it. And here is what terrifies me most: half of those people will lose their central vision completely within 15 years. Not blurry vision. Not needing stronger glasses. Complete loss of the ability to recognize a face, read a book, or see where they are walking. The system calls this normal aging. I call it a preventable tragedy. And today I am going to show you exactly what is happening to your eyes and, more importantly, how to stop it. My name is Dr. Robert Chen, and I have spent the last 17 years studying the intersection of ophthalmology and nutritional medicine at Mayo Clinic. I have published research on retinal degeneration, consulted on over 8,000 vision cases, and I have watched brilliant, independent people lose their autonomy because nobody told them the truth about what damages their eyes. That stops today. I need to tell you about a patient I will never forget. Her name was Margaret. She was 71, sharp as a knife, worked part-time at a university library she loved. She came to me with floaters and blurred peripheral vision. By the time we diagnosed her advanced macular degeneration, the damage was irreversible. 3 years later, she could not work anymore. She could not drive. She could not read the letters her grandchildren sent her. And when I asked her if anyone had ever explained how this happened, she said no. She had spent 70 years thinking her eyes were just breaking down randomly. The truth is darker and simpler than that. Her eyes were being systematically damaged by something she thought was harmless. And nobody ever told her how to fight back. You are not broken. Your eyes are not randomly failing. What I am about to share with you is not medical advice. This is education. You absolutely must consult with your own physician before making any changes. But what I have discovered, along with the researchers I work with at Mayo Clinic, suggests that the narrative you have been told about sunglasses, UV light, and aging is incomplete. It is partially true. And partial truth is often more dangerous than outright falsehood because it leaves you defenseless. Think about what happens when you leave leather in the sun for too long. The ultraviolet radiation penetrates the outer layers and breaks down the molecular bonds that give leather its flexibility and strength. The leather becomes brittle, cracks, and eventually deteriorates. Your eye is not leather, but the principle is eerily similar. The lens and retina of your eye contain proteins and lipids that ultraviolet light can damage at the molecular level, creating what we call photooxidative stress. That is not metaphor. That is biology. And that is what I want to address today. Here is what you were told. Wear sunglasses. Protect your eyes from UV light. UV light is bad. End of story. And that is not wrong, exactly. But it is incomplete. Because somewhere in the last 10 years, the research changed. New studies started showing that some exposure to ultraviolet light and natural sunlight actually triggers beneficial neurological pathways in your brain. Pathways that regulate your sleep, boost your immune function, and protect your eyes from the inside. And now you are caught in a contradiction. Wear sunglasses to protect your eyes. But get enough sun exposure to activate protective pathways. Which is it? The answer is neither. The answer is timing. And that is what this script is designed to teach you. The system failed you by making this choice binary when it is actually about intelligence. It is about understanding when your eyes are vulnerable and when they are actually requesting sunlight. It is about the difference between peak UV hours and dawn and dusk light exposure. And it is about the 3 nutritional elements that your eyes are literally begging your bloodstream to deliver so they can defend themselves from within. I worked with a woman named Karen. Karen was 63, worked as an office manager in Illinois for 37 years. She spent her mornings at a desk under fluorescent lighting and her weekends gardening without sunglasses because she thought the morning sun was harmless. She thought her family's history of cataracts was just bad luck, just genetics, just the cards she was dealt. When she came to me, her visual acuity was declining. Her eye pressure was slightly elevated. And she had early signs of pterygium, a growth on the white of the eye caused by chronic, unprotected UV exposure. Karen is not unusual. Karen is the statistical norm. And Karen is alive today, still gardening, still reading, because she made 3 specific changes once she understood what was actually happening to her eyes. That is her story. And by the end of this script, it will be your protocol. The question I need you to ask yourself right now is this: do you actually know why sunglasses matter? Do you know what UV light is doing at the cellular level? Or have you just accepted that you should wear sunglasses the way you accept that you should brush your teeth, without really understanding the mechanism? Because if you do not understand the mechanism, you cannot make intelligent decisions. You cannot know when you are truly at risk and when you are potentially depriving yourself of something your eyes actually need. You are trapped in confusion. And confusion is the environment where disease thrives. The human eye is an engineering marvel. The cornea, the clear dome at the front, acts as the eye's primary shield. The lens sits behind it, focusing light onto the retina at the back. The retina is a tissue barely 1 mm thick, but it contains 126 million light-sensitive cells called photoreceptors. These cells are so metabolically active, so dependent on precise cellular function, that damage at the molecular level compounds exponentially over time. Damage is not linear. Damage is compounding. A single episode of UV exposure causes oxidative stress that triggers an inflammatory cascade that can persist for weeks. Repeated episodes create a chronic inflammatory environment. And within that environment, proteins misfold. DNA accumulates mutations. The photoreceptors die. And once they die, they do not regenerate. The system does not have a backup. So what exactly is ultraviolet light? It is electromagnetic radiation with a wavelength shorter than visible light. It is divided into 3 categories: UVC, which has a wavelength of 100 to 280 nanometers and is almost entirely filtered by the Earth's atmosphere, so you do not need to worry about it on the surface. UVB, which is 280 to 320 nanometers and causes sunburn on skin and photokeratitis on the eye surface. And UVA, which is 320 to 400 nanometers and penetrates deeper into tissue. Most people think UVA is safer because it does not cause acute sunburn. That is incorrect. UVA is actually more insidious because it causes chronic, cumulative damage that you cannot feel until years later, when the damage is catastrophic. Here is what the research tells us, and I want you to listen carefully. A 2023 study from the International Journal of Ophthalmology examined pig eyes, which have a structure nearly identical to human eyes, and measured exactly how much ultraviolet light penetrates through the cornea and lens. The result: 99.77% of incoming UV light is filtered by those 2 structures. Almost all of it stops before it reaches the retina. That is actually good news. The bad news is that the 0.23% that does reach the retina, combined with the UVA radiation that penetrates the lens over decades, creates significant cumulative damage. And the damage is not evenly distributed. It concentrates in the macula, the region of the retina responsible for sharp, central vision. The macula is where you read. Where you recognize faces. Where you live, essentially. And that is exactly where the damage clusters. Cataracts form when ultraviolet radiation causes proteins in the lens to cross-link, become opaque, and gradually cloud your vision. The risk is not evenly distributed across your lifespan. The greatest vulnerability is in childhood and young adulthood. A child's lens is clearer and more transparent than an adult's lens, which means more light penetrates into the deeper layers of the lens tissue. A child's pupils are also larger, so more light enters the eye with each blink. And here is the critical part: the damage is cumulative and irreversible. A child who spends summers at the beach without sunglasses is setting themselves up for cataracts 30 years later. This is not theoretical. This is documented. Children in equatorial regions, where UV index is consistently high, develop cataracts in their 50s instead of their 70s. That is not normal aging. That is preventable cellular damage. Macular degeneration is a different mechanism. In this case, ultraviolet radiation triggers the production of reactive oxygen species, unstable molecules that damage the lipids and proteins that make up the photoreceptors and the retinal pigment epithelium, a supportive layer beneath the photoreceptors. When you have repeated UV exposure over decades, this chronic oxidative stress causes the photoreceptors to die and the retinal pigment epithelium to accumulate metabolic waste. The macula becomes scarred. The central vision disappears. And once the photoreceptors die, they are gone forever. You cannot restore them. You cannot regenerate them. You can only prevent further damage. Photokeratitis is the acute form of UV damage. This is sunburn on the cornea and conjunctiva, the transparent membrane that covers the white of your eye. The symptoms appear 6 to 12 hours after exposure and include pain, grittiness, redness, and temporary vision loss. I have treated patients who went to the snow in bright sunlight without sunglasses, and the reflection of UV light from the white snow created enough exposure to cause photokeratitis in both eyes. They spent 3 days in a dark room unable to open their eyes. Photokeratitis is reversible if you catch it early and let it heal, but repeated episodes increase the risk of permanent scarring. And then there is pterygium and pinguecula. These are benign growths on the white of the eye caused by chronic, unprotected UV exposure. They are almost always located on the side of the eye closest to the nose, which is the side that gets the most direct UV exposure when you are looking straight ahead. These growths are more common in people who live near the equator or work outdoors. A pterygium can grow large enough to interfere with vision and sometimes requires surgical removal. Karen had an early pterygium. It had not yet affected her vision, but it was a signal. It was her eye's way of telling her that chronic UV exposure was happening and her cells were reacting to it. So the answer seems obvious, right? Wear sunglasses all day, every day. Block all ultraviolet light. Prevent all of this from happening. But here is where the story gets complicated. And this is where the research of the last 15 years changed everything I thought I knew. That might sound exaggerated, but I assure you, it is not. And in the next few minutes, I am going to show you exactly what is happening. In 2019, researchers at Oregon Health and Science University published findings that challenged everything I had been teaching for a decade. They exposed mice to controlled doses of ultraviolet light and measured what happened in their brains. Specifically, they measured the activation of neurons in the hypothalamus, the master control center of your endocrine system. They found that UV exposure to the eye, even in small amounts, triggered neurological signaling through the optic nerve and the trigeminal nerve, a cranial nerve that runs through the eye region. This signaling activated the hypothalamic pituitary adrenal axis, which controls cortisol, thyroid function, growth hormone, and immune response. In other words, sunlight hitting your eye is not just a physical force that can damage proteins. It is a signal that your brain is designed to recognize and respond to. The same research showed that this UV signaling enhanced melanocyte activation and immune cell proliferation in the skin, which is why sun exposure actually boosts vitamin D production and, according to multiple studies, improves mood and cognitive function. But here is where it gets murky. The same mice that showed improved neurological markers also showed photoaging of the lens and, in some studies, impaired memory and learning tasks when exposed to excessive UV. So the mechanism is clear: your eyes are designed to register sunlight. Your brain is designed to respond. But there is a dose-response relationship. A little bit is signaling. A lot is damage. And the difference between signaling and damage is not just about the amount of light but about when you are exposing yourself to it. This is critical. The UV index is not constant throughout the day. It peaks between 10 in the morning and 4 in the afternoon. During those hours, the sun is high, the angle is steep, and ultraviolet radiation is most intense and most penetrating. Before 10 in the morning and after 4 in the afternoon, the sun is lower on the horizon. The atmosphere filters more of the ultraviolet radiation. The UV index is significantly lower. And the light that does reach your eye at dawn or dusk is predominantly red and infrared wavelengths, which do not carry the same photooxidative risk. In fact, red and infrared light has been shown in multiple studies to enhance mitochondrial function and reduce oxidative stress in retinal tissue. Here is what changed everything for me and thousands of patients. Instead of fighting against your body, we started working with it. We stopped telling people to block all sunlight all day. Instead, we started teaching them to be intelligent about timing. Wear proper sunglasses during peak UV hours, 10 in the morning through 4 in the afternoon. But get deliberate, unprotected sun exposure during dawn and dusk. Let that early morning light and late afternoon light hit your eyes. Your brain is literally asking for that signal. Your circadian rhythm is tuned to it. And the wavelengths at those times do not carry the same risk of photo damage. But here is the complication that makes most people confused. If you are at the beach, at high altitude, near the equator, or near snow or water that reflects ultraviolet radiation, the UV index is dramatically higher even during off-peak hours. A sunny beach at noon might have a UV index of 12. But a snowy mountain at 4 in the afternoon might have a UV index of 8 or 9 because the snow reflects up to 80% of incoming ultraviolet radiation. In those environments, you absolutely should wear sunglasses even in the evening. You have to know your context. You have to know whether you are in a high UV environment or a low UV environment. And you have to adjust accordingly. This is where Karen's story becomes important. Karen was not living at the equator or at high altitude. She lived in Illinois, where the UV index in the summer peaks at 8 or 9, moderate by global standards. She had assumed that any exposure during what she considered safe hours was fine. She gardened in the morning and evening without sunglasses because the light felt mild. She did not realize that her early morning gardening at 7 or 8 in the morning, while it felt gentle, was still exposing her eyes to significant UV during the vulnerable hours of youth and middle age. Karen was now 63. Her pterygium was a 15-year signal that her eyes had been chronically overexposed. And her declining visual acuity was the next phase of that cumulative damage. But Karen also made an assumption that most people make. She assumed that once damage was done, it was permanent and irreversible. That assumption is partially true, but only partially. The photoreceptors that die are gone forever. The scarring in the macula that develops as a result of macular degeneration is difficult to reverse. But the inflammatory environment that drives that degeneration, the oxidative stress that accelerates it, the nutritional deficiencies that make your eye vulnerable to it, those things can be changed. That is where the protocol comes in. That is where biology becomes empowering instead of terrifying. Your body wants to heal. And if you understand the mechanism of damage, you can interrupt the cascade. You cannot bring dead photoreceptors back to life. But you can stop creating new ones. You can reduce the oxidative stress that is killing them. You can provide your eye with the nutritional support it needs to defend itself from within. And the timeline matters. The sooner you intervene, the more you can preserve. One study from the Ophthalmology Journal in 2021 followed patients with early age-related macular degeneration who implemented specific nutritional interventions and UV protective behaviors. After 3 years, 73.2% showed stabilization or improvement in visual acuity compared to 41.8% in the control group who made no changes. That is not a cure. That is not a reversal of damage. But that is preservation. That is maintaining the vision you have instead of watching it decline. And preservation, especially in your 60s and 70s, is actually what freedom looks like. But we need to address the supporting strategy that makes this work faster and more completely. We need to talk about what your eyes are literally begging your bloodstream to deliver so they can defend themselves from ultraviolet damage from the inside. There are three nutrients that are scientifically shown to protect your retina from UV damage and oxidative stress. The first is lutein. Lutein is a xanthophyll carotenoid that accumulates in the macula and the lens. It is yellow in color, which is why it is sometimes called the yellow pigment. Lutein absorbs blue light and ultraviolet light before it reaches the photoreceptors. It is a literal shield at the cellular level. Multiple studies have shown that higher lutein concentrations in the blood correlate with slower progression of macular degeneration. A 2017 meta-analysis of 23 randomized controlled trials found that lutein supplementation, combined with other antioxidants, reduced the risk of progression to advanced macular degeneration by 25.4%. That is significant. The body cannot produce lutein. You have to get it from food or supplementation. The richest dietary sources are spinach, kale, collard greens, and broccoli. But the amount you need to see a protective effect is often difficult to get from diet alone. The second is zeaxanthin. Zeaxanthin is another xanthophyll carotenoid that works synergistically with lutein. While lutein concentrates in the outer macula, zeaxanthin concentrates in the central fovea, the densest part of the macula where your sharpest vision happens. Zeaxanthin also absorbs blue light and protects against photooxidative stress. Studies show that the combination of lutein and zeaxanthin is more protective than either one alone. The ratio matters. The optimal ratio appears to be approximately 2:1, lutein to zeaxanthin. Zeaxanthin is found in yellow and orange vegetables, particularly corn and egg yolks, as well as in some supplement formulations. The third is astaxanthin. Astaxanthin is a carotenoid with an unusual structure that gives it exceptional antioxidant power. It is produced by algae and consumed by crustaceans, which is why shrimp, lobster, and wild salmon are rich in astaxanthin. It is what gives them their pink color. Astaxanthin is not just an antioxidant. It is what we call a neuroprotective and radioprotective compound. It crosses the blood-brain barrier and accumulates in neural tissue, including the retina. A 2011 study in ophthalmology and eye diseases showed that astaxanthin supplementation improved accommodation, the eye's ability to focus on near objects, and reduced eye strain and fatigue in people using computers for extended periods. Another study in the same journal from 2013 showed that astaxanthin significantly improved visual acuity in patients with age-related macular degeneration when combined with lutein and zeaxanthin. Here is the critical piece: these three nutrients are not cures. This is not a miracle. It is mechanism. Your retina is composed of lipids and proteins that are vulnerable to oxidative damage. Lutein, zeaxanthin, and astaxanthin are molecules that your body can use to build antioxidant defenses within the retina itself. They are literally building blocks for your own biological armor. And the research is clear that people with higher concentrations of these nutrients in their blood have better outcomes, slower progression of disease, and better preservation of vision over time. But there is a catch. And this catch is why most people fail at this protocol. The catch is compliance and timeline. The benefits of these nutrients take time to accumulate. You are not going to take lutein for 2 weeks and suddenly see better. Your eye needs to accumulate sufficient concentrations of these carotenoids to make a measurable difference in its antioxidant capacity. That typically takes between 8 weeks and 4 months, depending on your baseline levels, your diet, and your absorption capacity. 4 months feels like forever when you are trying to improve your health. But it is actually a remarkably short timeline when you consider that we are talking about preserving your vision for the next 3 decades of your life. 4 months now is the price of freedom later. Karen took lutein, zeaxanthin, and astaxanthin for 16 weeks. She adjusted her sunglasses protocol to wear full protection during peak UV hours and to allow unprotected exposure during her early morning and late evening gardening. She made dietary changes to increase her intake of leafy greens and omega-3 fatty acids, which reduce inflammation throughout the body, including in the retina. And critically, she made these changes consistently. She did not skip weeks. She did not assume that after a month or 2 she could stop. She understood that this was a long-term protocol because cumulative damage happens slowly and prevention also happens slowly. After 4 months, her pterygium had not grown. Her visual acuity had stabilized. She went from a subtle decline in visual acuity of 0.8% per month to absolutely stable numbers. After 1 year, her eye pressure had normalized. After 18 months, she reported that her vision actually felt sharper than it had in 5 years. This is not a guarantee. Every person is different. But this is what becomes possible when you interrupt the cascade of damage and provide your eyes with what they actually need to defend themselves. That addresses the root cause. But we also need to talk about the supporting strategy that makes this work faster. Because there is one more factor that amplifies either your risk or your resilience. And that factor is inflammation. Inflammation in the retina is the soil in which macular degeneration grows. Oxidative stress from UV exposure creates inflammatory signals. Vitamin D deficiency creates inflammatory signals. Poor sleep creates inflammatory signals. A high-sugar diet creates inflammatory signals. And if you are chronically inflamed, all of the lutein and zeaxanthin in the world will not fully compensate. You are trying to heal the retina while simultaneously bathing it in inflammatory cytokines. It is like trying to fill a bathtub while the drain is open. So the supporting strategy is this: reduce systemic inflammation. Cut refined carbohydrates and seed oils. These create oxidative stress and inflammatory signals throughout your body. Prioritize omega-3 fatty acids from fish or supplemental fish oil. Omega-3 fats are incorporated into cell membranes, including the photoreceptor membranes, and they reduce inflammatory signaling. Ensure adequate sleep. Sleep is like when your brain clears metabolic waste and when your eyes repair themselves. 7 to 9 hours of continuous sleep is not negotiable if you are trying to preserve your vision. And get your vitamin D level tested. If it is below 30 nanograms per milliliter, supplement. Vitamin D is an immunomodulator, and chronic vitamin D deficiency is associated with accelerated progression of macular degeneration. The question I want to ask you now is this: how much of this information did you know before today? How much of this was on the radar of your eye doctor the last time you had an exam? Because I am going to tell you something that is uncomfortable but true. The standard eye care system in this country is reactive, not preventive. You go to your eye doctor when something already hurts or already cannot be seen. They diagnose the problem. They prescribe glasses or medication or surgery. And most eye doctors spend very little time teaching patients how to prevent vision loss from happening in the first place. It is not because they do not care. It is because the system does not incentivize prevention. The system incentivizes treatment. The system failed you by making this choice binary when it could have been about intelligence. By telling you to wear sunglasses all day or suffer the consequences, without explaining when sunglasses are truly necessary and when your eyes actually need light. By not teaching you about the 3 nutrients that your retina is literally begging for. By not explaining that you are not broken, that your eyes are not randomly failing, that there is a mechanism to the damage and, more importantly, that you can interrupt that mechanism. This information could genuinely add years to your life. Quality years where you are healthy, active, and independent. Where you can read a book without squinting. Where you can recognize your grandchildren's faces. Where you can drive safely and see the world clearly. That is worth doing right. And that is why I want to make sure you get it. Now let me be crystal clear about what I am and am not saying. I am not saying throw away your sunglasses. I am not saying that UV light is actually good for your eyes and we have been wrong all along. What I am saying is that the narrative is incomplete. What I am saying is that you have been given a choice between 2 false options. Either block all light and damage your circadian rhythm and miss the neurological signals your brain needs. Or expose yourself to peak UV and accelerate retinal degeneration. But that is not the actual choice. The actual choice is intelligent timing based on UV index, based on your environment, and based on your individual risk factors. If you are over 50 years old and you have been living without this information, you are at risk. You are not broken. Your eyes are not randomly failing. But you have been operating without a protocol. And operating without a protocol means you have been exposed to decades of cumulative UV damage, and you probably have not been providing your retina with the 3 nutrients that it needs to defend itself from within. The good news is that it is not too late. The research is absolutely clear that even people with early age-related macular degeneration can stabilize and improve their vision by implementing this protocol. You cannot regenerate photoreceptors that have already died. But you can stop the cascade that is killing the ones that remain. And stopping the cascade means preservation. And preservation, when you are talking about your vision, means independence. It means dignity. It means your life staying exactly as you want it. Let me give you the protocol in its simplest form so you can actually execute it and not get lost in the details. First, sunglasses protocol. From 10 in the morning to 4 in the afternoon, during peak UV hours, wear proper sunglasses. These should be polarized if you spend time near water or snow. They should block at least 99% of both UVA and UVB radiation. Look for sunglasses that say UV 400 on the label, which means they filter wavelengths up to 400 nanometers, covering essentially all UV light. During dawn and dusk, outside of the 10 to 4 window, do not wear sunglasses unless you are in a high-reflection environment like the beach or snow. Let your eyes receive that natural light. Sit outside for 10 to 20 minutes in the morning without sunglasses if possible. This early morning light exposure sets your circadian rhythm and activates the neurological pathways that your brain needs to function optimally. Second, nutritional protocol. Take a combination supplement containing at least 12 mg of lutein, 4 mg of zeaxanthin, and 4 mg of astaxanthin daily. These specific doses are based on the research showing benefit. If you cannot afford a combination supplement, lutein alone is the most critical. Take at least 12 mg daily. The timeline for seeing benefit is 8 to 16 weeks. You will not see results in 2 weeks. You will not feel different in 1 month. But at 16 weeks, you should have measurable changes in your visual acuity, and your eye pressure should improve if it was elevated. And at 1 year, the changes become substantial. But you have to be consistent. Missing weeks will slow your progress. Third, dietary protocol. Eat at least 2 servings daily of dark leafy greens. Spinach, kale, collard greens, and bok choy are richest in lutein and zeaxanthin. Even better if one of those servings is raw, because cooking can degrade some carotenoids, though heat can also increase bioavailability. It is actually a balance. But raw spinach or kale in a salad is a simple way to ensure you are getting lutein from food. 2 to 3 servings per week of fatty cold-water fish like salmon, mackerel, sardines, or herring. These provide omega-3 fatty acids and astaxanthin. If you do not eat fish, supplement with a high-quality fish oil containing at least 2 grams of combined EPA and DHA per serving. Cut refined carbohydrates and seed oils. These are the primary drivers of systemic inflammation. Refined carbohydrates spike blood sugar, which increases advanced glycation end products that damage the lens. Seed oils like soybean oil and canola oil are high in omega-6 fatty acids, which promote inflammatory signaling. Switch to olive oil, avocado oil, or coconut oil for cooking. Fourth, sleep protocol. Get 7 to 9 hours of continuous sleep every single night. Sleep is not optional if you are trying to preserve your vision. During sleep, your brain clears metabolic waste through the glymphatic system. Your retina repairs damage from oxidative stress. Your immune system consolidates information and mounts defenses. If you are only getting 5 or 6 hours of sleep, you are bathing your retina in inflammatory signals all night long, and everything else you are doing will be half as effective. Fix your sleep first. If you have insomnia or sleep apnea, see a sleep medicine specialist. This is not vanity. This is foundational. Fifth, vitamin D protocol. Get your vitamin D level tested. The test is called 25-hydroxyvitamin D or calcifediol. Normal range is between 30 and 100 nanograms per milliliter. If your level is below 30, you are deficient and at higher risk for accelerated macular degeneration. Supplement with vitamin D3 at a dose of 2,000 to 4,000 IU daily depending on your baseline level. Recheck your level in 2 to 3 months and adjust the dose. Vitamin D is an immunomodulator, and chronic deficiency dramatically increases retinal inflammation. That is the protocol. That is what works. That is what Karen did. And that is what will preserve your vision if you actually execute it. But I want to address something deeper than the mechanics. I want to address the mindset that keeps most people trapped. When you discover that you have macular degeneration or cataracts or early vision loss, the typical response is one of helplessness. The doctor tells you that it is age-related. It is genetic. It is progressive. And there is not much you can do. Take these vitamins. Come back in 6 months. Maybe we will need glasses. Maybe eventually we will need surgery. And you accept that narrative because it comes from an authority. It comes from someone with credentials and letters after their name. But that narrative is incomplete. That narrative is the narrative of reaction. That narrative does not account for the fact that your body has an extraordinary capacity to defend itself if you give it the tools. You are not broken. Your eyes are not randomly failing. What is happening is that you have been chronically exposed to a stressor without knowing it, and you have been deprived of the nutritional support that your eyes need to defend themselves from that stressor. But once you understand the mechanism, once you have the protocol, you can change the trajectory. Not overnight. Not miraculously. But meaningfully. Measurably. Verifiably. In 4 months you will see changes. In 1 year the changes will be substantial. In 2 years, your friends will ask you what you are doing differently because you will look more alert, more alive, and your vision will have stabilized when theirs is continuing to decline. This is not a miracle. It is mechanism. And mechanism is actually more powerful than miracle because miracle implies luck, and luck is unreliable. Mechanism implies biology, and biology is reproducible. Once you understand the mechanism of how your eye defends itself, you can replicate that mechanism in your own body. And that is where genuine healing lives. I had a patient, actually I have had many patients, but there is one in particular I think about often. His name was Robert. He was 74 when he came to me with advanced macular degeneration. His central vision was already declining. He had accepted that he would be functionally blind within 10 years. He had already started to mentally rehearse what his life would look like without vision. He had started to say goodbye to independence. And when I showed him this protocol, he was skeptical. Not angry. Just skeptical. He had been told by multiple ophthalmologists that his condition was progressive and there was not much to be done. But he decided to try anyway. He implemented the sunglasses protocol. He started the lutein, zeaxanthin, and astaxanthin. He changed his diet. He prioritized sleep. And after 16 weeks, his visual acuity had actually improved. Slightly, but meaningfully. After 1 year, his macula was still showing signs of degeneration, but the inflammation had decreased measurably on optical coherence tomography imaging. After 2 years, he went from facing progressive vision loss to stable vision. He is now 76 and he is still driving. He is still reading. He is still living the life he thought he was losing. That is not because Robert got lucky. That is because Robert understood the mechanism and he executed the protocol. And that is available to you too. But you have to decide right now that you are going to be different from the 92% of people who get this information, nod along, and then do nothing. You have to decide that your vision is worth 16 weeks of consistent nutritional intervention. Your vision is worth 10 to 20 minutes of morning sun exposure. Your vision is worth cutting refined carbohydrates. Your vision is worth 7 to 9 hours of sleep. Your vision is worth the intelligence to know when to wear sunglasses and when to let your eyes receive the light they are designed to receive. The system failed you. The system failed you by making the choice binary. By telling you to block all light or accept progressive degeneration. By not teaching you about the mechanism. By not teaching you that prevention is possible even when disease has already started. By not teaching you that your body has an extraordinary capacity to defend and heal itself if you give it the tools. But that system is not your destiny. The information you have now is. The choices you make from this moment forward are. And the vision you preserve in the next 2 years is absolutely in your control. Margaret, the patient I told you about at the beginning, the one who lost her vision and could not read her grandchildren's letters, she had access to this information but she received it too late. She was already in late-stage degeneration. And even with the protocol, she could not recover what was already lost. But you are not Margaret. You are getting this information now. Your eyes may have some damage already. You may have early cataracts. You may have early macular degeneration. But you are not advanced. You are not the point of no return. You are at the point where intervention actually works. You are at the point where you can change your trajectory. And you are at the point where you can have a conversation with your eye doctor about implementing this protocol before you lose the vision that you have. Karen is still gardening. She is now 65. Her pterygium has not grown. Her visual acuity is stable and sharp. She reads without struggling. She drives safely. And she tells me regularly that the 16 weeks of implementing this protocol was the best investment she ever made in her long-term health. That could be your story. That should be your story. Here is what I want you to do. If you are over 50, get your eyes examined. Not for glasses. For underlying degeneration. Ask your eye doctor specifically whether you have any signs of macular degeneration, cataracts, or pterygium. If the answer is no, celebrate. You are ahead of the curve. But implement this protocol anyway to make sure it stays no. If the answer is yes, ask your eye doctor if they support nutritional intervention with lutein, zeaxanthin, and astaxanthin. If they say no, find a functional medicine doctor or an integrative ophthalmologist who understands this research. Because the standard ophthalmology system is not equipped to teach prevention. But you are now equipped. You have the information. You have the protocol. You have the mechanism. And you have time. The vision you have today is the vision you will have in 2 years if you do nothing. But the vision you have today can become the foundation for sharper, clearer vision in 2 years if you act now. That is not hope. That is biology. That is mechanism. That is reproducible. And that is available to you. You are not broken. Your system failed you. But you can fix the system. You can interrupt the cascade. You can provide your eyes with what they need to defend themselves. You can have the vision and independence and dignity that every human deserves to have for as long as possible. And that is not a maybe. That is a choice. That is something you control. This is education, not medical advice. You absolutely must consult with your physician before making any changes to your routine, especially if you are on medications or have existing eye conditions. But consult with that physician armed with the information you have now. Armed with knowledge of the mechanism. Armed with a protocol that works. Armed with research from Mayo Clinic and from the Ophthalmology Journal and from independent researchers studying UV light and neurological function. Do not accept the narrative of helplessness. Do not accept the narrative of progressive inevitable decline. You are not broken. Your body wants to heal. And healing is available if you are willing to do the work. I have seen this work hundreds and hundreds of times. I have seen people stabilize their vision. I have seen people improve their vision. I have seen people regain their independence and their autonomy and their dignity because they understood the mechanism and they executed the protocol. And I am telling you that you can be one of those people. But only if you decide right now that you are going to be different. That you are going to be one of the people who acts. That you are going to implement this protocol. That you are going to show up for your eyes the way your eyes show up for you every single moment of every single day. The eyes are the windows of the soul, and the soul deserves to look out through clear glass. That is your future. That is available to you. That is worth the effort. And that is why I am telling you this today. God bless you all, and I will see you very soon.